This research study, funded by the New Dynamics of Ageing programme, was looking at the impact of depression following a hip fracture in older adults. We followed people up who'd developed depression and those who hadn't after they'd had a hip fracture and tested them at 6 weeks and 6 months. And what we found was those individuals who had depression on top of their hip fracture, they had worse outcomes. So they were not as good at activities of daily living. This is things like just managing the washing up and moving around the home. They struggled to balance, although that did improve a bit by 6 months, and they also had slower walking speed, so much worse mobility if you develop depression on top of hip fracture. We're basically looking at how long it takes an older person to get out of a seated position and walk 3 metres and then return to the chair. And we also look via a questionnaire on how well they manage activities of daily living, so things like the washing up, cooking, doing the laundry.
I'm very lucky because I've got good family and I've got good supports. And I know, and there were people in there that were very depressed and didn't really want to go home because they're isolated. So you do get depressed because I got very frustrated because I couldn't walk my dogs. But I do push myself. It's all in your mind.
So about 5 years ago, we carried out a study looking at hip fracture. And what we found was that 4 out of 10 of them came down with very serious infections like pneumonia. And we really wanted to understand what was influencing the pneumonia, why only some of the patients had very poor health after their hip fracture. And what we thought was going on was that the stress of the hip fracture was suppressing your immune function so that you became more susceptible to the infections. We had 103 patients with hip fracture who became involved in the study, and of those patients, 37 of them came down with a depression. They'd never had a depression before. And what we found was that in the ones that didn't have depression, they also had less infections. The group that did develop a depression, even 6 months later, they hadn't recovered their physical function properly, and that group had more infections. And importantly, it was only in that group that we found that their immune function was suppressed. So importantly, it looks like the stress of a depression affects your immune system much more than the stress of the hip fracture.
After my hip fracture, I didn't feel well at all. I didn't feel myself. It took a long time to get back to normal. Yeah. I think the doctor should pay more attention, really, to how I felt.
So what we think that is really the important outcome of our study is that we really need to take depression in hip fracture patients very seriously. There are several ways forward, so it's important to try and make sure the hip fracture patient isn't socially isolated. So if you know somebody with hip fracture, perhaps visit them as regularly as you can. But what our study showed was that one of the hormones in the blood that helps us to fight infection and also helps us to keep you in a good mood, that was lower, and this is called DHEA. Now this is a hormone that we can give as a tablet. It's very cheap, and so what we're hoping in the future is that we'll try giving this to patients to see if it reduces the depression and helps them to recover from their hip fracture much more quickly. The benefits of this intervention are, we think it would cost as little as £7 a week to treat a patient with hip fracture. It has no side effects, but it would really save the NHS because it would reduce the number of readmissions to hospital after the hip fracture with serious infections. And importantly for the patient, it would mean that they regain their function much more quickly, and also there would be reduced numbers of deaths, because the mortality from hip fracture is 25% after 1 year, so that's 1 in 4 patients pass away a year after their hip fracture, so it's a serious problem.